everybody. I'm Otmani. I'm an assistant professor of medical informatics in Faculty of Medicine and Pharmacy office. Today, I'm pleased to present my literature review on the use of artificial intelligence methods in healthcare. This presentation will be organized as follows. Artificial intelligence is a subfield of computer science that generally refers to computer systems and algorithms that simulate a specific aspect of human intelligence or behavior, such as learning, reasoning, or problem solving. Artificial intelligence is a rapidly growing field of research with a promising future. Its application concerns all human activities. Healthcare is a living system that generates a significant volume of heterogeneous data. Following the availability of open public databases and connected objects, and the refinement of computational models and algorithms coupled with powerful computer, there has been massive progress in artificial intelligence in recent years, with the development of multiple approaches and techniques aimed to extracting knowledge from megadata using automatic or semi-automatic methods. Especially in machine learning, natural language processing, artificial intelligence voice technology, and robotics. The use of artificial intelligence in healthcare offers many opportunities that support decision-making. It's applied in complex diagnosis, assistance, delivery of health services, evaluation of different aspects of healthcare, assisted operation, personalized treatment, and other domains. This use can also be extended to prospective interpretation, providing disease prediction to better prevent health risks and early prognosis. In such a way that intelligent and interactive analysis of health data is becoming important to optimize resources and enhance quality of care and health outcomes. Then, the objective of this presentation is first to give an insight of artificial intelligence's main methods and its application in the field of healthcare, as well as to discuss its limitations and challenges. So, we conduct a literature review of articles published in PubMed during the 5 last years using artificial intelligence and healthcare as keywords. Our literature review showed that the number of publications in this field is constantly growing. Most of the publications were literature reviews and clinical studies. About 1/3 of publications was from USA. And about half of them explored the use of machine learning in healthcare, which was used especially for prediction, to make diagnosis, or for surveillance. Generally, deep learning algorithms was the most used. For example, the paper published in 2020, which aimed to develop and validate a machine learning model to predict a length of stay in primary shoulder arthroplasty. The artificial neural network was trained and validated based on a national inpatient sample between 2003 and 2014. The accuracy and the area under the curve were calculated and demonstrated that the model has the potential to preoperatively predict length of stay. Here, a second example that aimed to understand the health behaviors of the public toward recommending interventions to curtail the transmission of coronavirus disease based on user-generated content from social media during previous outbreaks. A correct neural network algorithm was used and was shown a good accuracy, sensitivity, and specificity. We also noticed that about 4% of publications were dedicated totally to discuss the ethical consideration of the use of artificial intelligence. Our review shows that the artificial intelligence methods in healthcare are increasingly studied. However, they are still not widely used in the daily practice of clinicians. We also noticed that among all the articles found by our research query, no publication was made by an African institution. This can be explained by the fact that we limited the search to a single query, but also by the use of BML, which is a bibliographic database more used by doctors than by computer scientists. Therefore, we can deduce that head population in the African continent are still not very interested in research in the field of artificial intelligence, which leads us to recommend to African researchers to dig into the research team using their own data so that the models developed are more fitful to their context. Although artificial intelligence has realized great success in the health field, it has some limitation. For example, it does not reveal causal relationship or clear understanding of the phenomenon in the study. Instead, it's like a black box unable to justify its decisions. Also, for tasks that require common sense reasoning or domain-specific knowledge, or for situations that fall outside of the artificial intelligence training data set, artificial intelligence remains limited. Additionally, in case of base data, the algorithm tends to reproduce or even reinforce these biases. So, it's up to artificial intelligence researchers to make sure that the future impact of it is more positive than negative, and to take steps to monitor technology advancements and ensure that preventive and precautionary protections are in place to protect people involved the right from direct or indirect coercion. In conclusion, cornerstone of successful model is to build clear strategies for integrating different artificial intelligence technologies into the existing care system to effectively solve the most pressing problems that health organizations currently face. We also need to access to good and US medical data for training machine learning algorithms. Additionally, scientists and researchers from fields such as biomedical science, psychology, ethics, economics, law, and politics must be involved together in the development of artificial intelligence application to define norms of justice and equality and to identify acceptable and safe behavior of artificial intelligence used